Hi there, happy International Women's Day. I wanted to jump on here and share a few quick facts with you and some qualities in healthcare providers that you can be looking for as a chronic pain sufferer that can increase your sense of control as you move through your chronic pain journey. First and foremost, women suffer more longer with chronic pain. The data widely supports this information, so just take a look and you'll be able to see that women are, in fact, suffering from chronic pain more than men. As many as 70% of all chronic pain sufferers identify as women. And interestingly, one of the major gender disparities in healthcare research is that 80% of chronic pain research is performed on men. So it does make it difficult for healthcare providers to take information that was performed on men and to extrapolate it and be able to help women. So it's just one thing that does make it more difficult for healthcare providers to provide adequate care for chronic pain sufferers who are women. Women also are prescribed painkillers less than men for the exact same procedure, such as a coronary bypass. And women sit in the emergency room longer before receiving pain medications for abdominal complaints. These are just a few of the disparities that women suffer that are worth noting in this conversation and our time together. So let's focus on what's important. What qualities in a healthcare provider could you be looking for that are going to empower you to be in control of your chronic pain? And one of the hints are, I just used one of the words, empowerment. We are looking for healthcare providers that empower you, not disempower you. And what qualities are those? Well, they include things like sharing wisdom. They are able to connect with you, they care, and they're competent. The opposite is true for care providers who are disempowering. They lack competence, they're uncaring, they're disconnected, and they're lacking in wisdom. So let's go back to focusing on competent providers and how they make you feel. They give you a sense of control, and you're able to maintain that control. And so that leads to something that we call remoralization. And remoralization is just what it sounds like. You being back in control and full of life and also empowered to continue through your chronic pain journey with a new sense of control and empowerment. And I think that's where we'll stop today because it's not even worth discussing those that disempower you. Because disempowerment leads to feelings like demoralization, and it can make things like remoralization difficult. But the good news is even if you have had encounters with healthcare providers that have been demoralizing and maybe not very connected, you can still come across someone who inspires you and remoralizes you. So don't give up hope. I do encourage you to find a healthcare provider you connect with along your chronic pain journey, and I wish you much success in healing.